Dr. Sims, we all know that representation matters. And quite frankly, we need more people who look like you and I in healthcare. So what do you think young folks who see people like you and I in our respective roles think about pursuing a career in medicine or in healthcare or in sciences or any of the so-called STEAM career paths?
I think it is vitally important that people see others who look like them, that we share our stories, that we celebrate the diversity that is within even our own community. And I spoke earlier about the inspiration that I had from seeing Dr. Ben Carson in 1987 and 1988. Just seeing someone who looked like me gave me that thought of, maybe I can do that. And I hope that people see me and get that sense of inspiration, but also communicating about the importance of the diversity, communicating about my history, letting people know that I come from the west side of Chicago, the west side of Chicago. And I didn't grow up on third base. I had to grind it out. I had to work hard. I was surrounded by poverty, drugs, and gangs, but I kept my vision straight and I relied on my community. And so letting people know that we're not that different. But not everyone shares that story of coming from inner city and whatnot. And so then it comes to, well, what did you do to be successful in sharing that playbook? I sought mentors. I asked for help. I sought scholarship and I pursued excellence vigorously to make sure that I made it. I didn't make excuses. And all of those people who allowed me to put my hand in theirs and they pulled me forward, they opened the door for me. It's now incumbent upon me to do the same. And I have to not only feed into the pipeline, but to be accessible, to be tangible. And so one, we have to highlight the fact that yes, we do need more providers. When we have opportunities to mentor, that we're there for those providers. But even if it's not just medicine, I make sure to talk about the science, as you say, science, technology, and engineering, mathematics. If someone doesn't want to be a doctor, you can be a nurse or a physician's assistant or a dentist or a technician. There's so many different avenues for people to pursue. It doesn't just have to end with MD. It can end with PhD or a master's degree or a bachelor's. So many opportunities. So I want to make sure people understand that it's not a one path fits all. You don't have to go to medical school. And if you don't want to, there are other things that you can do to enter medicine. No matter what you do, number one, feel free to change your mind. I told you I thought about being a neurosurgeon, and I carried a burden because I told everyone once upon a time I was going to be a neurosurgeon like Dr. Ben Carson. And when I was deciding to go in a different direction, I knew people would say, hey, what happened? And it's okay, own your narrative and your story and say, I have a different interest. There are other things that I want to pursue, and this is a better fit. So changing your mind is okay. But also letting people know to be curious. Don't lock yourself in. Be open to different pathways. Maybe it's science, maybe it's tech, maybe it's financial technology. There's so many things that you can do. But whatever you do, pursue excellence, find mentors, people who look like you, ask questions, ask for help. And in doing that, I think we can really rise the number of people who are in our professions and who are giving back. I make sure everyone knows, no matter what you're doing, you can't just look forward, you have to look and reach back to give people opportunities, because someone gave me an opportunity. How different would my life have been if the chair of orthopedic surgery at Stanford didn't come to me and say, hey, would you like to be the team doctor and medical director for the Golden State Warriors? We had a lot of people in the department. He gave me an opportunity. And so we have to look for opportunities, advocate for ourselves, advocate for others, and pursue it when we get it to the best of our abilities. And so that's what I hope that I can use this for. And I try to share messages like that in interviews like this or in community meetings. And I make sure that I'm accessible to our community, whether it's through churches or community health organizations, or through schools, Boys and Girls Club, you name it. I try to be actively engaged and involved to make sure that I'm feeding into the visibility, but also the growth of people like us in these professions.